Good morning or good afternoon. Thank you for joining today's presentation about leadership communication strategy, advocating to strengthen the healthcare workforce. Effective communication from a leadership standpoint is critical in advocating for enhancing the healthcare workforce. It fosters efficient collaboration among stakeholders and ultimately contributes to well-informed decision making. The following slides discuss how this can be done, the importance and effect of stakeholder communication. The agenda for this presentation is as follows: importance and examples of strategic leadership, methods addressing healthcare policy to strengthen healthcare, effective communication strategies and implementation challenges, alignment of strategic communication to stakeholders, and advocacy communication strategy to strengthen healthcare workforce. Starting with the question, why is strategic leadership important in healthcare? Strategic leadership plays a critical role in healthcare by enabling organizations to maneuver through the intricate and swiftly evolving healthcare landscape effectively. It also guarantees that resources are utilized efficiently to enhance the quality of patient care. Some examples are transactional leadership, relies on the exchange of transaction between leaders and their subordinates. The example of this is performance monitoring within healthcare setting. The next one is transformational leadership, which is contingent upon effective communication, as leaders can solely articulate their vision through it, or commonly called as lead by example. The example of this involves encouraging intellectual stimulation among nurses by involving them in decision making. Visionary leadership shares similarities with transformational leadership as it revolves around leaders formulating a vision, goal, or objective. The example of this is considering the perspectives and experiences of patients and their families. Finally is collaborative leadership, which establishes psychological safety in the workplace by promoting employee participation and cultivating a collaborative environment. An example of this is implementing a comprehensive company-wide communication tool. Leaders may employ various methods to persuade stakeholders, one of which is presenting a data-driven evidence, which entails collection of robust research, clinical data, and cost-benefit analysis. Organizations may not spend financially on data-driven presentations if employees are equipped with tools and specifics. Another approach is identifying relevant parties. This includes collaboration with other departments and sharing similar goals and vision. Employees can brainstorm to identify the people or groups of people that can help, which may not incur any extra charges to the company. Next is cost-effectiveness analysis, which is identifying potential funding sources, including grants, government initiatives, and private investments. The leader should explain the financial sustainability before and after implementation. It can be free of charge by utilizing an in-house analyst. Otherwise, a company may incur an annual expense depending on the state. Effective communication is conveying the values and goals of establishing a resilient workforce, which will also address potential concerns. This would not cost an organization any expenses, as this is one of the skills leaders should have. Lastly, public awareness campaigns effectively deliver the message to stakeholders by utilizing media outlets and social media to educate the public. This method may cost more than the previous strategies, as the company may spend an average cost anywhere from $15 to $200 per day, or $450 to $6,000 per month to manage an account for social media advertising. Leaders use strategies to communicate the organization's visions to stakeholders effectively. Some of the effective communication strategies are craft a clear and succinct vision statement, tailoring communication to different audiences, explaining the why behind the vision, active listening and feedback, regular communication, and updates. Some of the challenges that needs to be aware of are complexity of the vision, excessive detail, diversity, resistance to change, and lack of transparency. Some of the reasons to align strategic communication efforts to the organizational culture of the stakeholders with the current and future needs of the population is because it enhances relevance through thoroughly comprehending stakeholders' values, beliefs, and communication styles, and it also advances stakeholder engagement by addressing the population's current and future needs. Some of the methods that can be used are utilize culturally relevant language and channels, integrate feedback loops, actively engage with diverse communities, anticipate future trends, and transparency. The strategy that aligns with the mission and goal is strategic alignment, which is a vital strategy that ensures a company's goals and mission are closely integrated. I am advocating to strengthen healthcare workforce, and here are some strategies for implementation. The first one is formulating a succinct and coherent vision, and the leader can communicate the vision, which is every healthcare organization and community has access to sufficient, well-trained, adequately compensated, and supported health workers capable of delivering essential health services and addressing health threats. The second one is identifying intended audiences. The leadership communication will be towards the policymakers, planners, and managers. These stakeholders play a pivotal role in health workforce policy and planning, and therefore the primary targets of this advocacy. The next one is providing the reason for advocating to strengthen the healthcare workforce. And the reason behind it is because strengthening the healthcare workforce directly influences the accessibility of high-quality healthcare for the populace. A scarcity of healthcare workers can result in restricted care availability, prolonged wait times, and potential deterioration in the quality of patient care. The next one is gathering feedback and addressing inquiries. The organization of a meeting aimed to deliberating on the intricacies of the advocacy and addressing any queries that they may have. And finally, communication and updates, wherein stakeholders are urged to consider the escalating demand of patient care attributable to an aging public, prevailing workforce, burnout among healthcare personnel, and geographical differentials in healthcare accessibility. I appreciate your attention and engagement. For my closing remarks, advocacy is binding for enhancing the healthcare workforce as it is fundamental to patient well-being and the efficacy of healthcare provision. Advocacy plays a pivotal role in refining policies and investments that bolsters the healthcare workforce while also addressing burnout through facilitating access to behavioral health services and mitigating associated stigma. Thank you and have a great night.